Good morning, good afternoon, ladies and gentlemen, everywhere you are. My name is Abdel Hakim Yassouf. I am Senior Technical Cooperation Specialist for Africa and Latin America within the Islamic Development Bank. At the bank, we believe that all countries from the South have something to share in terms of knowledge and expertise. That is why I am excited to talk to you today on what solutions are possible to build the capacities of the national public health laboratories in Africa in response to COVID-19 and how we can address the global challenges through South-South and triangular cooperation. Before starting, I would like to thank the team members of the Regional Reverse Linkage project between Institut Pasteur of Dakar and the network of laboratories in 10 sub-Saharan countries, namely Dr. Amadou Sall and Dr. Osman from the Institut Pasteur de Dakar, and Mrs. Raghda Sha'rawi, Mr. Ayman Qasim, and Mr. Mohammed Sheikh from the International Islamic Trade Finance Corporation, and my colleagues Riyad Raghib and Muntasir Ahmed and Dr. Al-Arbi Nafati and the whole reverse linkage team. I would like also to thank the DGs of the team labs and their staff. Throughout my presentation, I will cover the following presentation. I will start by presenting the Islamic Development Bank Group at a glance, as well as the reverse linkage mechanism for South-South and triangular cooperation. After, I will jump to the project context, scope, and the expected result. And I will also address the win-win arrangements of the project and the progress made. And before concluding, I will talk about the future of this initiative. Before presenting the project, I would like to give you an overview on the Islamic Development Bank Group. The group is an international financial institution with a current membership in 57 countries across 4 continents: Africa, Asia, Europe, and Latin America. Its mission is to promote comprehensive human development with a focus on the priority areas of alleviating poverty, improving health, promoting education, improving governance, and prospering people. The Islamic Development Bank Group is headquartered in Jeddah, Saudi Arabia, with a field presence in 11 hubs and 1 center of excellence. The group is comprising of 5 entities, namely the Islamic Development Bank, the Islamic Research and Training Institute, IRTI, the Islamic Corporation for the Insurance of Investment and Export Credit, ISEC, the Islamic Corporation for the Development of the Private Sector, ICD, and International Islamic Trade Finance Corporation, ITFC. At the Islamic Development Bank Group, we are providing a set of products and services to our member countries, including public and private project financing, trade financing and promotion of intra-trade and regional integration, SMEs microfinance, fund asset management. We are also providing insurance of investments and export credit, research and training on Islamic economics and finance, development of Islamic financial service industry, science, technology and innovation, scholarship, and also capacity development and technical cooperation. For providing capacity development within the group, we are using and we developed in 2015 the reverse linkage mechanism. Guided by the principle of South-South cooperation, the reverse linkage is a scaled-up and result-oriented technical cooperation mechanism whereby member countries of the group exchange their knowledge, expertise, technology, and resources to develop their capacities and devise solutions for supporting the implementation of their national development plan. Through this mechanism, the bank plays the role of facilitator and connector to mobilize resources and identify development solutions from across the world, south and north, to meet the challenges of our member countries. The core feature of these mechanisms include the following. First, strategic alignment. The needs are expressed by the member countries in line with their national development priorities. Inclusivity, all member countries have something to share, and therefore they could be provider and recipients of knowledge. The third core feature is win-win arrangement. All the participating countries in any reverse linkage initiative, they have something to gain through the transfer of knowledge, expertise, and technology. The fourth feature of our mechanism is ownership and commitment. And here, all partners will be contributing to reverse linkage initiative through grants, in-kind contribution, and other mode of financing. And the last one is peer-to-peer approach. Here, the approach is facilitated by the bank to ensure that experts from the provider institution work hand in hand with their counterparts in the recipient country for designing and implementing the project. Regarding the context against which the project comes in, and as you know, since the beginning of this year, the entire world has been facing a very challenging context caused by the COVID-19 pandemic. In this context, the Islamic Development Bank Group took bold and quick action to support its member country to navigate through this pandemic. The group launched the Strategic Preparedness and Response Program to support member countries' efforts in preventing, containing, mitigating, and also recovering from the impact of the COVID-19 pandemic. The program adopts the 3R approach known as response, restore, and restart. Capacity development was adopted as a cross-cutting theme for the group response to the pandemic. And I would like to highlight that the group is using reverse linkage mechanism as a modality for delivering capacity development under this program. And as mentioned before, this mechanism is based on sharing knowledge, solution, and expertise between the member countries. And the reverse linkage modality allows, therefore, the group to leverage the capacity of a network of developers for skills and know-how development, to promote technical cooperation with the member country and the country from the south, and to partner also with the private sector for capacity development and expertise transfer. Under the context, I would like also to highlight that the national laboratories are playing a key role in fighting COVID-19 pandemic in all stages of this process: detection, diagnostic, assessment, response, notification, and monitoring. However, national laboratories are suffering from a shortage of skilled personnel, technicians, scientists, and lack of equipment to carry out their mandate. They have limited national guidelines and operational procedures, including for quality control. These causes have impact on the capacities of the laboratories for conducting mass testing and therefore limiting the spread of these deadly diseases within the community. Against this background, there is a pressing need to build the capacities of the African national laboratories to play an integral role in the country's preparedness and response to COVID-19 pandemic. The regional reverse linkage project that I am presenting today comes in this context. The overall goal of the project is to contribute to the national effort in responding to COVID-19 pandemic and enhancing the resilience of the health sector in the targeted countries to fight communicable diseases through the transfer of solution and expertise from the Institut Pasteur de Dakar to their counterpart in Africa, and to build a strategic partnership with other technical and financial partners to support this initiative. The activities of these regional initiatives that are being carried out in collaboration with various partners, including the Institut Pasteur of Dakar, which is the main provider of knowledge. And we have also ITFC, we have Africa, We have Arab-Africa Trade Bridge Program, and we have the BADIA, and we have the African Union Agency for Development, as well as the World Health Organization, the Africa Regional Office. This regional initiative is benefiting from the proactiveness of the Islamic Development Bank Group to identify Institut Pasteur de Dakar as a center of excellence that can share knowledge with the other African countries, specifically the diagnostic process of COVID-19. The bank agreed with the Institut Pasteur of Dakar to extend its support not only for one country, but to 10 countries, namely Benin, Burkina Faso, Cameroon, Chad, Cote d'Ivoire, Guinea, Mali, Mauritania, Niger, and Togo. This initiative is now benefiting from the learning, knowledge, and expertise sharing between Institut Pasteur de Dakar and its network in these 10 sub-Saharan countries. It is worth to mention that Institut Pasteur de Dakar is a major biomedical research institution in Senegal, and its influence extends to West Africa and beyond. And the Institute excels in a variety of health-related sectors, including research, immunization, training, capacity development, and strategic guidance. The project will specifically focus on strengthening organizational capacity of the laboratories and developing their human skills, in addition to the communication, monitoring, and evaluation components. The project is now under implementation for a duration of 1 year and a half, and with a budget of $1.5 million. By the end of this project, it will be able to achieve the following outputs. A learning and knowledge sharing platform will be developed. More than 150 lab staff will be trained on COVID-19 testing management, quality assurance, biosafety and biosecurity. Technical guidelines on COVID-19 will be adopted and used. The 10 laboratories will be furnished with the necessary equipment, such as the real-time PCR machine, biological safety cabinet, and other equipment. Laboratories information management system and data sharing will be provided for Institut Pasteur de Dakar, and public health disease surveillance is enhanced and effective response is ensured. In terms of outcomes of this initiative, it is expected that by the end of the project, to help 10 African countries to achieve the following results. The preparedness and response to soften the impact of COVID-19 and beyond will be enhanced, and synergy and complementarity among the African countries to fight COVID-19 pandemic will be created. As mentioned before, the project is adopting a win-win arrangement among all the stakeholders and the partners. And for example, for the beneficiary countries, national public health laboratories will be furnished with medical equipment and equipped with updated SOPs. Skills and technology of laboratory staff will be developed and enhanced. From the perspective of Institut Pasteur de Dakar, the Institute will get international experience and exposure as a provider of knowledge to other countries from the South. And this project will be an opportunity to the Institut Pasteur de Dakar to expand its knowledge in a different context and learn from this experience. From the third party, which are the Islamic Development Bank, the ITFC, and the other partners supporting the initiative, this initiative is in line with, for example, the Islamic Development Bank Group strategy and the President's 5-year program, and it will contribute to SDG number 3, good health and well-being, as well as to SDGs 17 partnership for the goals. Now, regarding the progress, after carrying out the capacity and need assessments of the 10 labs, we are now conducting training on COVID-19 testing management. We are purchasing the equipment for the 10 laboratories, and we are providing the laboratories with the labs with the information management system and data sharing, and we are also developing the learning and knowledge sharing platform. Regarding the future and the outlook of this project, the main priorities of this initiative for the upcoming years are as follows. First, we want to expand the geographical outreach of this initiative. The initiative will continue its advocacy at global, national, and regional levels for raising awareness on the importance of building the capacities of the laboratories as an important stakeholder and cornerstone of the healthcare system. This would lead to allocating more resources for the benefit of the African laboratories through domestic resources and international cooperation, and therefore covering at least all the African less developed countries. We will be also enlarging the scope of this project by including ecosystem of the labs as a new component for creating the enabling environment for the labs and sustaining the result of this initiative. And we are also trying to scale up the partnership around this initiative by mobilizing more partners within Africa from the global south and globally for sharing knowledge, bringing more resources to expand and to sustain this initiative. In conclusion, at the Islamic Development Bank Group, we believe that South-South and triangular cooperation constitutes one of the key pathways toward promoting a multilateralism and mutual development agenda that address our collective challenges, both with respect to dealing with the ongoing pandemic, as well as in achieving sustainable development goals in this decade of actions. And before closing, I would like to launch the following appeal. Let's work together to harness the huge potential of South-South and triangular cooperation for addressing the global challenges, specifically the COVID-19 pandemic, through pooling our knowledge, expertise, and resources. This is the end of my presentation. Thank you all for your being here today and taking the time to listen to my presentation. I also invite you all to watch a short video on the project available on the Paris Peace Forum platform that will give you more clarity on how we are using South-South cooperation and triangular cooperation approach to solve our problems and to tackle the pandemic of COVID-19. Now, I will be more than happy to react to your question and comment regarding this initiative and regarding our approach within the Islamic Development Bank Group. Thank you. I received some questions, and I will try to respond to some of them. The first one is saying, how do you coordinate with government or institutional actors, for example, Ministry of Health? Yes, regarding the coordination, yeah, we have a mechanism, a governance structure of this project, and we have a coordination mechanism for this project. The coordination mechanism is a committee that is composed of the recipient country. The Ministry of Health is the main player in this project, and we have a representative from the provider institution, and we have all the partner, financial and technical partners that are supporting the initiative. They are members of this committee, and this committee is organizing meetings every semester to see the progress of the project and to solve some constraints and to give some guidance on the implementation, on the orientation of the project. But in the field, we have also a small management unit within the Ministry of Health, managing the activities of the project, planning the activities, organizing the activities in the field. And they are in contact with the bank on a daily basis. And I think through this governance structure, a management unit in the field, and a coordination committee involving all the stakeholders, we are able to manage the implementation and to give guidance to the implementation of this project. I have another question saying, where do you want to replicate the model to expand the geographical outreach? Yes, based on this initiative, now we are expanding the initiative to all less developed countries in Africa. We have just yesterday approved another project similar between Comoros as a beneficiary and Tunisia, Institute Pasteur of Tunisia as a provider of knowledge. And we approved also yesterday another project between Sudan as a beneficiary and the diaspora of Palestine as a provider of knowledge through the diaspora. And we will be also expanding to other countries. We are in partnership with the African Union Development Agency to cover the remaining less developed country in Africa. Our objective is to cover at least 20 countries in Africa, but also we are expanding this program outside Africa. We have other projects in the pipeline in Asia, in Uzbekistan, for example, and in other countries. The geographical will be expanded, and the targeted country will be specifically the less developed country, which are our priority at the time. I have another question from your experience with the implementation of this project. What are the lessons we learn from such initiative in developing world in general? I think we are drawing a lot of lesson from this initiative. The first one is that all countries, they have a wealth of knowledge that we can tap on it and we can capitalize on it. And through this South-South cooperation, we can harness a huge potential of knowledge, of expertise that we have in all countries. And I think cooperation, South-South cooperation as a lesson is a powerful tool that allow to tap on knowledge, on expertise in all countries. And multilateralism, cooperation, I think, is a powerful tool to be used, especially under the pandemic of COVID-19 and in all crises, and also in achieving sustainable development goal. We are advocating, we are believing that South-South and triangular cooperation is a strong tool that could be used, and that we have a huge potential that it is not at the time being used, and we should promote such cooperation scheme. I think I have another question or comment. Great project, and thank you for your presentation. This initiative has been successful enough that even once of the COVID-19 crisis is over, you see that this being extended to other such emergencies. Yes, very important question. We are now focusing on COVID-19 pandemic, but all the capacity that we are providing to country, they will allow them to tackle other crises, other communicable diseases. And our investment in terms of capacity development, in equipment, it's not only for COVID, sure, it will help country to develop the resilience and to be able to tackle any crisis in the future. And for example, I can give you the example of Comoros, for which we approved yesterday a project. They, at the time being, they don't have a lab in the hospital for testing COVID. They are using a lab in the agriculture center research. And I think for Comoros, through our project, they will be creating a lab, and they will be creating the capacity not only for COVID, but for all communicable diseases. I have another question, final question to wrap up your pitch. How do you hope, how do you hope this edition of the Paris Peace Forum will support the work of your project? I think for us, this is a great opportunity to share our project with all the participants and to look for partnership. We are, as I mentioned at the conclusion, we are looking for more partners from the south, from the north, to continue our project, to expand our project, and also to expand the scope of the project. I was talking about the ecosystem of the labs. Labs, they need also the enabling environment that allow them to continue to sustain their intervention. And I think Paris Forum will help us to get more partners. But also maybe we can replicate our initiative in other countries, in other continents. Why not? In Latin America, in Asia, if they want to learn from our experience, we are ready also to collaborate and to replicate this initiative outside Africa. I think I replied to all the questions. Again, I will thank all of you for your interest, for your participation, and for your interaction. And I will be more than happy to continue interacting with you through my emails, through other channels, and we can discuss again and see how we can work together and how we can build our partnership and our collaboration, and how we can use the Paris Peace Forum as a platform for more collaboration. Thank you so much. See you soon and stay safe. Goodbye.